Hello, namaste. I hope I'm audible now. Let me know. I'm sorry I didn't listen to your message. So I missed it. I didn't read your message. Am I audible now? Am I audible? I hope I'm audible now. Yes? Okay. So today's topic, I'm not wasting time now. Today's topic is on Mixopathy and Ayurveda. So mixopathy is a very interesting topic because nowadays mixopathy is very common in Ayurveda prescriptions because most of the Ayurveda physicians are combining various forms of medical systems like yoga, naturopathy, acupuncture, and whatnot. So many other things also in their prescription. So this is one dangerous trend which is currently happening. Yoga is considered to be a part of Ayurveda today, but it is not correct. Yoga is an entirely different science of healing. So when an Ayurveda doctor is recommending yoga procedures, there are certain problems because Ayurveda is an independent science which advocates science of diagnosis, science of decision of treatment principle. We are treating diseases, diagnosing diseases based on different diagnostic and treatment principles. And this treatment principle implementation, how to implement these treatment principles, that is also recommended in Ayurvedic science, which are to be adopted. There are nutritional guidelines, there are medicational guidelines, and also exercises are there, but when to do exercise, what kind of exercise, and various other things are very important based on the certain things, exercises. There are contraindications for exercise, but without considering that, yoga procedures are mentioned most of the times by Ayurveda physicians in their prescription. That is one thing. Not only that, many medications, herbal powders, etc., which are not sure of, like there will be no label. You must make sure that if you are prescribed a formulation, even by a qualified Ayurveda doctor without a label, don't accept that. It is very important that all the Ayurveda formulations are available with good quality control procedure following manufacturing companies are there. So they will be mentioning all the ingredients in the label also. So it is your fundamental right to understand that what medicine you are taking and what the medicine is doing, what you can expect in the following hours after starting the medication. You can ask your concerns, you can share your concerns with the doctor. Suppose you are prescribed something with no label, don't accept that, or just make sure you receive the formulation with label. And sometimes what Ayurveda doctors do is this, they will be telling orally to you, they will not be prescribing to you. This is also a very bad trend because when you are there are so many things to be explored in a patient before deciding the medication. So it is really important that you are to be examined, your disease status is to be examined, the diagnosis is to be arrived at, Ayurvedic diagnosis is to be arrived at. It's not like when you bring a report to your doctor, your Ayurveda doctor will read that and make the diagnosis. It's not like that. We have to explore so many things based on the history of your disease, your life history, your lifestyle, how you started this disease, whether it was preceded by any other illness for which you had what. All these things are very extremely crucial to reach a very basic Ayurvedic diagnosis. So what is the problem is that immediately this medicine in that disease, when you tell that you are having acidity, immediately a doctor is prescribing you Avipatti Churna or something, whatever it be. I just gave one example, but immediately he is prescribing you some medication. It is wrong. You can take it, it is wrong and it is irrational. The doctor has to work on you really sincerely to arrive at Ayurvedic diagnosis, and he has to explain to you what he is doing, and your response has to be evaluated. First response is very important. In the following hours, what is happening, that you have to report, and if there is any adverse thing which is happening in your body, you have to report it immediately. So if you are prescribed medicines without labels, Even you cannot claim that, sometimes verbally, some physicians are prescribing. You cannot even file a suit against that doctor because you are not prescribed a medicine with label. It's your mistake to accept such medications without labels. So the thing is that there are so many different kinds of medications. Sometimes the most worst of everything, allopathy medications or Western medications, are seen commonly in Ayurveda prescriptions. It is very pathetic because most of the Ayurveda doctors are not confident in practicing Ayurveda. It is not their problem, it is the basic problem of education. Professional education is not without flaws, or even some basic qualities should be there in the professional education of BAMS to make an Ayurveda physician confident in his profession, right? He is becoming a practitioner of Ayurveda. He's not intended to become a practitioner of modern medicine or yoga or naturopathy or whatever it is. He is ultimately, BAMS degree is given to him after 5.5 years, which means that he is intended to be a scientific Ayurveda practitioner. But what is happening today? More than 90% of Ayurveda prescriptions contain antibiotics, paracetamol, so many other things. I will say that it has to be legally criminalized. It is not a fair thing. It is a very illegal thing to prescribe medications or procedures of other systems of medicine by a scientific Ayurveda, I mean qualified Ayurveda practitioner. He should be prescribing Ayurveda medication itself. And before that, he should be writing his scientific diagnosis. It's not a mere like translation of fever translated as jwara in the prescription. Jwara is the technical terminology in Ayurveda for fever. So it is not like that. Ayurveda is a science which is recommending to practice functional medicine. What is this functional medicine? Functional medicine means on the whole, the human being is considered. It is not like mind, body, soul, and it is not like that. Every finest aspects of physiology and pathophysiology are able to be integrated in the same human being at the same time with Ayurvedic science. So that is it is possible only by such an approach. Originally, Ayurveda is advocating functional medicine and SBBA is practicing functional medicine. We are able to translate that breakthrough scientific understanding into clinical situations. The breakthrough scientific understanding we get from the science of Ayurveda regarding diagnosis, treatment, prognosis, differential diagnosis, everything. Our basement knowledge lies in the science of Ayurveda, not somewhere else. We cannot get basement knowledge of science of man from statistics. We cannot get from modern pathology also. It is mentioned in Ayurvedic science. So we have done certain research. Me and my husband, we were doing functional medicine oriented research in Ayurveda. Don't get confused. In modern medicine, functional medicine refers to pharmacogenomics, evaluating the gene and deciding. Again, it has got so many confusions. Ayurvedic science is highly vast, complex. There are all the subtlemost mechanisms happening in a healthy or diseased persons can be integrated, and it can be understood or comprehended in its own unique environment in relation to external environment. Such a kind of uniqueness is there for Ayurvedic science. So it is not like when suppose a patient is having acidity, we will have to inquire questions what he had eaten at that time, whether he took sufficient water, what kind of water he drank, since when he is having acidity, whether his acidity is acute or chronic, it has been there for long period. If it was there for long period, what he had been doing, what he had been practicing as diet, regimen and medication for the same, and how was their response to the same. And before developing acidity, did he have any other problems for which he underwent certain medications? Does he have any other diseases along with acidity, like for example, hypertension or allergy or hypothyroid? So the basic physiology and pathophysiological mechanisms. How is his digestion, metabolism, circulation, internal drainage, external drainage, immune mechanisms, all these things, the functionally we are able to assess in a human being in relation to his external environment. Human being keeps varying. Like now, what am I differs from after 5 minutes or 10 minutes. What am I depending on my various conditions inside and outside. So this is what is called functional medicine with regard to Ayurveda. So what a physician needs to do is he has to keenly observe the patient, examine the patient, understand the patient, explore the patient, work on the patient to understand what all cause mechanisms has led him to this problem. Sometimes other diseases can be there. Okay, sometimes hypothyroid might be the initiating cause. Hypothyroid might have led to poor metabolism and diabetes. So the patient might have had hypothyroid first, followed by onset of diabetes after a few months or years, followed by dyslipidemia. So everything underlying causes hypothyroid. Sometimes hypertension is there later. Sometimes diabetic neuropathy is there by uncontrolled blood sugar. So it is not like for blood sugar, one medication is prescribed, neuropathy, another thyla or something is done. For dyslipidemia, some anti-drug in Ayurveda for that. It is not like that. We have to find out, explore the underlying cause. This hypothyroid is the underlying cause. Whether hypothyroid is autoimmune or not. If it is autoimmune, we have to focus on autoimmunity principles, treatment principles. Only science-based, evidence-based Ayurveda is practicing functional medicine. How you can be sure of? Because we are practicing with most minimum dosages of one classical Ayurveda medicine or two medicines maximum at one time. We are not treating for different diseases separately. We cannot do that. There is no such an option in Ayurveda because Ayurveda as such is, it is a functional medicine oriented science. It is a complete science. It is a holistic science. Ayurveda advocates diagnostic and treatment principles to integrate the multiple pathologies happening at the same time and intervene upon the underlying cause, root cause, and reverse all the problems. It is like you are targeting or at the exact initiating cause means all the effects are to subside. We are not doing any suppression, blocking, masking, etc. That is what is called reversal of disease. So SBB is able to do that because SBB is practicing functional medicine. What is happening in conventional Ayurveda is, as such a kind of functional medicine oriented approach is not educated in colleges. So people are taught experiences. Teachers will be telling, in my experience, Vaidyaranavasti is best for this condition. Then the students or doctors, future doctors will be thinking only of Vaidyaranavasti. When a condition comes, Vaidyaranavasti will be the first prescription, first prescribed medicine. Or in my experience means it is not scientific. Scientific does not have personal prejudice. Scientific means what? It is absolutely led by science. It is explored in the patient, and you are able to, a physician is able to explain to you what is happening in your body, how you got the disease, what is your involvement. Desh. Desh means DESH. D means diet. E means exercise. S means sleep. H, very important, how you managed. How you manage the particular symptom or the disease. This DESH, dash. This is the crucial components. These are the crucial components of functional medicine of Ayurveda. It's very important. You cannot explore diet in a lab. You can explore the impact of diet only in the unique individual. You can explore exercise effect only in the individual. You can explore sleep, daytime sleep if he is doing. Whether it is daytime sleep is absolutely contraindicated in many conditions where poor metabolism or inflammation or infection. So whether the patient is sleeping in the daytime, whether the patient is drinking unboiled water. See, the crucial most but brilliant aspects of Ayurveda is this. Modern medicine, even after 1 century, they will not recognize that unboiled water is different from boiled water and its impact in the state and stage of infection or inflammation or poor metabolic status. They will take another century perhaps. This is what their method of analytical reductionism is. But at Ayurveda, it's not like that. So everything what he is doing, what other medications, so that there lies the problem of mixopathy. So Ayurveda doctors will prescribe 5 medicines. Why to prescribe 5 medicines? When you know what is to be done, there is a specific treatment principle. Based on that treatment principle, you can choose the medication also in Ayurveda. Because all the medications are explored for their cause mechanisms. There are documented cause mechanism impact in explained for all Ayurveda formulations, explained in Samhitas. So we can easily choose one right formulation. We are having more than enough medications. We don't need to develop new medicine or for anything. We must understand, we must develop new intelligence to apply medication correctly. That is what is required, not new medicine. Intelligence should be cultured and revised. We should be able to choose the right treatment, right medication. Then what happens? It is like very aimful. It is not like time consuming. People think that Ayurveda is beneficial only in chronic diseases, not in acute diseases and emergencies, medical emergencies. We are able to manage medical emergencies. SBBA practitioners are doing many kind of medical emergencies. It is possible to be managed very fast, impact by SBBA. Why we are doing that? Because we are not prescribing 5 to 10 medicines. We are understanding and applying the right principle oriented one medication with scientific nutrition schedule and medicated water, and thereby we are monitoring the patient. Hypertension we can monitor 200, 120. Suppose his BP is, after 1 hour we can check, and we can also evaluate the clinical improvement, how the patient is responding. So this is always based on the patient's unique environment. So when we are prescribing many medications, polytherapy, what happens? Acharya says, our ancient scientist says very strictly, Nacha Kriya Sangaro Hida. You should not be prescribing multiple medications, because all the medications will be working on variable principles and body gets confused. It is just like computer, when many programs, many windows are open, what happens? Computer gets shut, what you call stuck. Same way, human body also is a much complicated computer. I mean, it's not like computer. It is highly complicated, vast, and subtle most mechanisms are happening in human body. So when you are administering different medicines, different procedures at one time, I mean, even Ayurveda procedures wrongly, without understanding what is happening, what you are going to do, naturally you will be prescribing many medications and procedures, if at all needed, it is restricted to less than 5% patients only. Panchakarma therapies are required only in less than 2% of overall population in India. Nowadays, what is happening? For every disease, Panchakarma is intended. Most of the times, Panchakarma is done in wrong status also. Inflammatory status, poor metabolic conditions, and Visha, toxicity conditions, not external Visha. There are many diseases where internal cellular toxic metabolites are causing various diseases. In such condition also Panchakarma is done. So it is very dangerous. It is mentioned in the science that it is contraindicated. Panchakarma is contraindicated in such conditions. But unfortunately, people are resorted to these things only because of, I will say, education has to improve in quality. Then only. There is no functional medicine oriented education in Ayurveda at present. Only SBB is doing this. So the thing is that when you are prescribed other medications also, like for example, homeo medications, Western medicine medications. What is the nature of Western medicine medications? It is done, the mode of action. I don't know how many of you know that. If the mode of working of Western medicine is blocking, masking, suppressing, supplementing. So it is various enzymes, hormones. They are sometimes immune system is masked, suppressed. Like this, it is working. And hypertension, it is the what you call adrenergic receptors are suppressed. Beta blockers. It is from the term itself. It is clear. Beta blockers. It is suppressing or blocking beta adrenergic receptors. So such kind of action is done. So along with that, it is not, they are not focusing on the cause. Now recently I read in a post by the liver doctor that inflammation, we are assessing inflammation and giving treatment for inflammation. So the treatment for inflammation is anti-inflammatory drugs, which is doing nothing but blocking of the pathway of inflammation and not reversing the cause of initiating cause of inflammation. Why inflammation is happening? It can happen by infection, it can happen by injury, it can happen by autoimmunity, it can happen in hypothyroid, wherever metabolism get deranged, it can happen. It can happen by several other causes, immune mediated causes. So the initiating cause is to be attended and reversed. For there is no such a thing, so they are giving anti-inflammatory. In fever, they are giving paracetamol. Paracetamol is not attending the cause mechanisms, initiating cause mechanisms. It is just suppressing fever. That's body temperature. That's all. So such kind of approach. Along with that, antibiotics, they are aiming to kill bacteria, not reversal of infection. Infection is not bite of bacteria. Infection is response of immune system towards bacteria. You know, infection is the response of immune system. You think that when bacteria is present in my body, I will get infection. It's not like that. Always colonies of bacteria are there in my body, in your body also, inside and out. There are so much of virus in your body, around you, always. You cannot stay in a sterile environment always throughout your life. Your immune system is constantly fighting and enabling you to stay out of illness. So what is to be focused? Immune system is to be focused. So it is like when you are taking antibiotics also, your immune system is getting suppressed. Even paracetamol is deranging immune system. That is why recently I read in a study that those children who are frequently administered paracetamol, they are getting allergies, different kinds of allergies. Parents are not aware of this. So when Ayurveda doctors are prescribing these things, it is shame. It is disgrace. It is disgrace to the system. It is disgrace to each and every Ayurveda doctor in the community. It's a big shame. It should be legally criminalized. That is what I say. How can an Ayurveda doctor prescribe modern medicine? I don't know why it is not considered as a serious offense. Nobody can do that because we are learning pharmacology for understanding their mechanisms of drugs. Because most of the patients who are reaching us might have undergone modern medicine and coming to us. So we must be knowing exact mechanisms, how they are working. This, it is absolutely necessary to learn the pathology, modern pharmacology. All these are enhancing our confidence in our system of medicine, because we are having more deeper, subtle most, more complex, vast, brilliant mechanisms to connect various pathologies and treat the patient. It is not like this medicine. Suppose a patient comes with, some time before I got a patient with COVID-19 positive. He was having not viral fever features. He was having urinary tract infection also, surprisingly. After so many days of hospitalization, he was in ICU. His daughter got him discharged forcibly and brought him. So that time on an evaluation, it was noticed that he was having urinary infection along with pneumonia. So which is the first one that happened? Whether it was pneumonia or urinary infection, we don't know. So the treatment principle for urinary infection was applied by me in Ayurveda. With that, his pneumonia also started subsiding. I didn't give any pneumonia treatment principle in that patient. I gave treatment principle for managing his urinary infection. With that, his pneumonia improved, his blood parameters improved, his inflammatory parameters improved, he started moving, his oxygen saturation improved. Just one case. Like this, many cases now Hastalamba team is doing. They are doing wonderful job. Our team Hastalamba, they are doing free surveys, managing all kinds of infective fevers. So we have trained them and they are doing it, and they are doing it without any medication. Can you imagine? People who are having pneumonia or dengue fever or some infection, typhoid or something else. They are managing without a single Ayurveda medication, just by medicated water, scientific diet. So, how is that possible? It is possible because of the accuracy of the science, precision of the science. That is what is called medical science. Medical science means it is not based on newly emerging compounds or trial oriented, benefit risk oriented, data oriented some compounds. It's not like that. There should be a precision in what you are doing. What you are doing, why, how, if at all not responding, again what you are doing, why, how the patient is responding. That we are monitoring the patient and doing and enabling him out of medication and disease. Yes, that is the role of medicine, medical science. This is what medical science is supposed to do. Take the patient out of disease, take the patient out of need of medicine. Health. Health is the objective of Ayurveda, which is a functional medicine. So, along with that, some five Ayurveda medicines, some modern medicines, they are working on different principles. Ayurveda medicines working against the cause mechanisms. So, if you are giving so many medications together in a human being, it's not a dummy, it's a human being, how dangerous it is. Sometimes immune suppression is continued and some Panchakarma procedures are given. Sometimes during Panchakarma procedures, BP shoots up. Antihypertensive is continued along with Panchakarma. I don't understand. Most of the times, faculties, Ayurveda faculties, I have heard from PG scholars. It is shocking to me. I'm a faculty of a college where there is no PG. But PG scholars have told me this, my former students. Madam, we are not allowed to stop allopathy medications during Panchakarma procedures or during treatment of Ayurveda. I'm shocked to hear this. How can they say like that? Modern medicine working principle is entirely different. Ayurvedic scientific working principle is entirely different. How can they mix both these together and do in a patient? Is there any study, is there any research that the patient is safe on this suppression from one side and activation from the other side? Is there any data or any study going on to evaluate the risks of such kind of what do you call that is also considered as a mixopathy, and this mixopathy is encouraged in Ayurveda colleges. It's shocking, it's very sad, pathetic thing which is happening. And in Ayurveda colleges, yes, recently I saw modern medicine prescribed in the OPD. So many prescriptions. How dangerous it is. What is the logic of doing that? What is the logic of prescribing antibiotic and along with or anti-inflammatory things, along with that Ayurveda medications? Does anybody study this? Does anybody evaluate this? What is your objective of doing this? What do you expect in the patient? You expect symptomatic suppression. Symptomatic suppression is happening by modern medicine. Then why do you give Ayurveda? It's not like Ayurveda to reduce the side effect. There are so many myths around this mixopathy. Ayurveda is given to reduce the side effects. Okay, modern medicine can do something to what you call suppress or block, mask, whatever they do. They will just keep the symptoms away in the patient and calm the patient. Now, patient can be given Ayurveda medicine side by side to boost their immune system, to reduce the side effects of Western medicine. How foolish it is. Can anybody who is doing this rationalize this just under this video? I'll be happy to hear you. Just tell me why you are doing this. Why you are prescribing modern medicine along with Ayurveda? Why you are ready to prescribe Ayurveda medicines to a patient who is undergoing all these modern medications? On what basis you do this? What is your rationale? What is your logic in doing this? There is no blocking, masking and all in Ayurveda. We can only reverse the cause mechanisms. So this is another dangerous thing what you find in mixopathy, and there is no wonder that people like there is one liver doctor, Dr. Abby Philip, who is abusing Ayurveda every day by some or other, by his ignorance. He doesn't know ABCD of Ayurveda. He's telling so many things. But I will not blame him when he shares something with an Ayurveda prescription. Recently, I have seen an Ayurveda prescription by an eminent college of Ayurveda. where allopathy drugs are prescribed along with Ayurveda medications. What is the logic of doing that? It's a college in the sense students are coming and learning there, right? So you are creating generations of diffident practitioners. You are creating generations of irrational prescribers who can cause tremendous harm to humanity. There is no clinical audit in Ayurveda. Anybody can do anything. There are no rational standards of prescribing in Ayurveda. See, we have been addressing this for many years. We have given a specific proposal to ministry also, like there should be a clinical audit. We have emerged certain rational standards. In SBEBA, we have emerged. We have sent all the details. There should be revision in the guidelines. There should be some guidelines to diagnose, to treat. Currently, diagnosis is not fair. Just translation of modern terminology is happening, which is not the Ayurvedic diagnosis. We have to diagnose based on cause mechanisms. That is what is called scientific Ayurveda diagnosis. So this is not happening. And again, Mixopathy and this what you call there are integrative medicine nowadays. It is a very common term, integrative medicine. What is this integrative medicine? Along with conventional medicine or modern medicine, some complementary treatments are given. Yoga or acupuncture, Ayurveda. Ayurveda is considered to be an alternative or complementary medicine. How sad it is. Ayurveda is the only functional medicine system in human being. Ayurveda is a complete science of man where every aspect of morbidity, life is discussed in detail. It is a highly vast, complex physiology is there, pathophysiology is there, diagnostic principles are there, treatment principles are there. Don't consider Ayurveda as grandma's medicine. It is not this medicine in that disease. It's not what you hear around you. It's not what you find in internet. Ayurveda tea, Ayurveda immune booster tea, or cholesterol reducing tea. It's absolutely foolish. It's not Ayurveda. What you see in internet, what you see around in markets, it is not Ayurveda. Okay, so Ayurveda means always we have to analyze the cause mechanisms and prescribe. That is, but alternative medicine or this what you call integrated medicine. Conventional medicine cannot be stopped. Okay, conventional medicine will be continued. Conventional medicine means Western medicine. They will be continuing their job of blocking, masking, suppressing, supplementing, etc. Along with that, Ayurveda doctors are supposed to do some jokes. It is like what you call. I am remembering buffoon in the circus. We are not less than buffoons. Buffoons are very clever. They are able to make such a tremendous audience do their job and make them laugh, amuse. But we are not clever also. We are doing some complete idiotic things by practicing this. We are prescribing some medications along with that modern medicine also, some yoga also, some herbal supplements also. It is not treating, it is cheating. See, every medical system with a scientific basement deserves to stand on an independent footing. Independent footing, that is very important. Ayurveda is not like when a person is walking through field, he found some herb, chewed it, his fever subsided, he found it as antipyretic. It's not like that. There are elaborate diagnostic principles, prognosis, estimation of prognosis, differential diagnosis of fevers. Fever is mentioned as an independent disease. With the diagnostic principle of fever, I am able to reverse all kinds of fevers which are present today, including dengue fever, typhoid fever. I am treating confidently with the same principles which are written in our science before 5000 years. My son had dengue fever before 3 months. I applied the principle 5000 years before principle. Okay, it is written before 5000 years. That time dengue fever is not written in the science. But I applied that principle and reversed my child's fever in 3 days. And dengue status, platelet count, whatever it be, everything got normal in 7 days, 7 to 9 days. So that is what is called science. So we are able to do that because of the practice of functional medicine. We are understanding, we are able to translate that logics in the science, scientific understanding, breakthrough. It is actually SBBA is a breakthrough discovery in Ayurveda to practice functional medicine. We are able to understand certain things, principles in the science. We are able to translate that principles into clinical situations, and we are able to get the intended results without doing polytherapy, without practicing mixopathy, without practicing alternative medicine, integrated medicine. So integrated medicine differs from mixopathy in the sense integrated medicine, conventional medicine is always there. Along with that, you are doing some comedies that is called integrated medicine. It is not fair. It is not fair when estimated by an Ayurveda scientific practitioner or Ayurvedic science. Why? Because a disease or a set of disease, sometimes one disease mismanagement can cause a new disease. Sometimes the same cause mechanisms of one disease, if they are blocked, masked, suppressed, etc., it can lead to another disease. Sometimes various disease pathologies can exist together in the same patient. So the duty of Ayurvedic science is to explore the patient, to understand the subtle, most vast, intertangled cause mechanisms, and decide the arrive at the scientific diagnosis and reverse the cause mechanisms by applying the right treatment principle explained in the science. So it is only that kind of approach is advocated in Ayurveda. Then how we can allow modern medicine involvement, interference? It is actually a big harm to the patient. No, just like modern medicine doctors are telling you continue this and do whatever else. We cannot say like that. You continue, you take this and do whatever else. We cannot say. We means Ayurveda doctor, scientific Ayurveda doctor cannot tell that. Why? Because we are not doing masking, blocking, suppressing, etc. We are doing precise cause mechanism reversal steps. For that, when we are doing that, we are taking responsibility of the patient. Very important. When we are asking if the patient is willing to stop modern medicine, then and there itself our responsibility begins. SBBA practitioners know what I am speaking about. We are taking the responsibility of the patient. See, modern medicine, it is easier. You can prescribe some symptom suppressants or anti-inflammatory. In fever, you can prescribe paracetamol or infection antibiotic, whatever it is, and some other Medicare, diabetes, anti-diabetic, dyslipidemia, anti-cholesterol. Such a patient comes to us with viral fever unresolved. We have to ask the patient if he is willing to stop all other medications. Then only I can treat for viral fever. And when I am treating viral fever, I must make sure that I am applying such a principle which is oriented to stimulate his metabolism, drainage mechanisms, everything, immune mechanisms, and ensure that his sugar level is coming down naturally without any anti-diabetic medications and even Ayurveda medicines, which conventional Ayurveda doctors are giving in diabetes. I'm not giving anything. I'm just focusing on viral fever. With that, the patient's metabolic status is improving, drainage status is improving, and patient is getting back to health. This is what is happening. I'm not exaggerating what I'm doing, only I'm speaking. So all the SBBA practitioners who are dedicated are doing this. So this is the success of SBBA, science-based, evidence-based Ayurveda. So what I'm telling is integrated medicine is not possible to be practiced in Ayurveda because of this reason. Conventional Ayurveda, conventional medicine, modern medicine interference is very vast, and you cannot even integrate with yoga or naturopathy because principles are different. Yoga has its own independent scientific substratum, logical substratum. Naturopathy has its own. Every system, Siddha has its own independent scientific substratum. Western medicine has its own medicine-oriented methods, statistics, biostatistics. So we cannot integrate all these things and do something, and ultimately patient is important. So patient is to be well. So don't think that you don't prescribe allopathy or you don't allow allopathy. It's not that same point I am also staying on. Patient is important. We cannot do trial and error on the patient by giving suppression from one side, activation from the other side. Patient is important. We have to take responsibility to make sure no such studies are there. If there is any study, you post here where Ayurveda plus allopathy is causing intended effects. Benefit risk is not a scientific study. in Ayurveda. In modern medicine, an unknown compound is administered, so they can evaluate benefit risk. In Ayurveda, it's not like that. There is a known science, there are known principles, there are known medications which are already explored for cause mechanism effect, which are documented in the science. So there is no question of randomization, blinding. All these are very illogical in Ayurveda because Ayurveda is a deterministic science. Ayurveda advocates deductive reasoning, general to specific, not a probabilistic science which advocates inductive reasoning. So this kind of problems are happening in Ayurveda today. Mixopathy is also very common. I'm winding up. If you have any questions, you can post under this video. I will not be removing this video. Okay. I will not be removing this video because this, I believe it's a very relevant video to be watched by everyone. And if you have any questions like modern medicine, finally to conclude, my point is this: modern medicine, it is absolutely patient's will to choose which system he wants. We can, every doctor, including Western medicine, Ayurveda, homeopathy, Siddha, whatever it is, they have to communicate with the patient openly what they are doing, how their medicines are working, and what they have to expect in the coming hours and days. What, generally, many times, physicians are not doing this. Most of the times, they are not doing this. It is very bad because patients have the right to know what they are doing inside, and if they get side effects in Ayurveda is happening by irrational prescribing like this polytherapy, many medicines aimlessly, labelless medicines, sometimes what you call mixopathy. This can definitely cause side effects. It is undesirable effects. It is not side effects. Actually, Ayurveda, when it is practiced as scientific medicine, science-based medicine, there cannot be side effects. There can be undesirable effects with mixopathy, unscientific practices of Ayurveda. In scientific administration, if there are side effects happening, it is not side effects. It is by some mistake in the diagnosis, some mistake in choosing medicine that it happened. So every physician of Ayurveda must ask the patient to report within not more than 72 hours, the first response, and make sure everything, because DASH is very important. D for diet, scientific nutrition schedule according to the nature, cause, mechanisms of the disease. Exercise, whether it is intended, what kind of exercise, how long he can do, what is the, what you call, how much to do, all these aspects. As for sleep, whether the patient is sleeping, I mean, what about the sleep, how the sleep is to be modified according to the disease status, whether he is getting adequate sleep or sleep should be prohibited in the daytime, all these aspects. And H, what most important, how it is managed. How it is managed, whether you are choosing the right principles in the science and you are giving the right medication, and previously what was done, what is the impact of that in him or her. These things can be explored and understood by a scientific practitioner of Ayurveda. So that is called Desh. Okay, so these things, unfortunately, mixopathy is there. Modern medicine, yoga, Siddha, everything is mixed with Ayurveda in prescriptions. Let us stop it. It's a very bad trend. It's happening because there is no clinical audit, there is no rational prescribing standards. Anybody can do anything with Ayurveda. I wish that this video is watched by Honorable Prime Minister Narendra Modi ji. Suppose he watches this video, perhaps I'm sure he will understand the seriousness of the problem. Maybe he is not aware that this much problem is existing today in Ayurvedic scenario. So I'm winding up. Thank you. I will come again with a different topic after some time. Okay. Jai Hind. Take care.